Hello, everyone. Thank you so much for joining us on day 2 of the 2020 NHF Virtual Bleeding Disorders. We're so happy that you're joining us for this session. Just a few housekeeping items. We want you to get the most out of this session, so please remember that you can add any questions or comments in the chat at any time during the session, and we will be responding to those as we go. You can also send a question in the ask a follow-up question, and the speakers will email you your responses to that question. I just want to remind you that at the end of the session, we want you to give your feedback. You will receive an email following the day of the session with an evaluation link, and we would really love you to fill those out because they really help us to, adjust our programming and love to give speakers feedback. Now, I want to take this time to introduce our 2 fabulous speakers. First, we have Michelle Kim, Executive Director of the Hemophilia Foundation of Southern California, and Kira Calvero, who is the Program Manager at the Hawaii chapter of NHF. Welcome, you two, and thank you so much for being here.
Thank you so much, Christy. My name is Kira Calvero. I currently live in Hawaii. I am the new Hawaii chapter program manager, and I am a carrier of hemophilia B.
Hi everyone, my name is Michelle Kim. I'm the Executive Director of the Hemophilia Foundation of Southern California. I live in a little town called La Cañada, which is next to Pasadena, if you're familiar. I have an adult son with severe hemophilia A. I have an adult daughter with a platelet disorder, and I also have mild hemophilia A. Thank you and welcome. Next slide. So we just wanted to share that we are not experts on public health, but just completely passionate and desirous of a world where all people, despite their color or creed, will have access to quality health care. And we're so thankful to NHF for giving us this opportunity to dialogue about this important issue. And we were also thrilled to hear from Len yesterday about the Big Sky Project, wherein he mentioned that health equity is a priority strategic goal for NHF. So before we continue, next slide, thank you. I think it's really important that we always start with definitions. So we'd like for you to add in the chat, what is your definition of AAPIs? Why don't you share with us what you think, and there's no wrong answer. I take that back. European American, that would be a wrong answer, but we're really hoping that this presentation can be as interactive as possible given the virtual Zoom or virtual platform here. As you're adding into the chat, I do want to mention that Asian Pacific Islanders are actually the fastest growing ethnic population in the United States. That might be very surprising for many of you. We are the fastest growing population. However, we also represent an incredibly diverse group spanning nearly 100 different ethnic groups. And while this is a growing population, we really vary quite greatly in terms of demographic and socioeconomic characteristics. Nevertheless, we are often seen as one race. I'm going to have Kira further elaborate on the definition of Pacific Islander.
So Pacific Islander is kind of an inclusive term that combines a bunch of the different islands within the Pacific, and that can include people from New Caledonia, the Marshall Islands, Tahitians, Tongans, Fijians, and of course the Hawaiian population as well.
And actually 2.4 million people make up that ethnic group. I think what's really interesting is that despite the fact that there are so many different ethnic groups within the AAPI community, we are truly seen as one race. And I just wanted to share an example of that. Last week, I went and got a COVID test. Don't worry, I was negative, but it's okay because we're virtual. I was negative, but when I did my demographics, which thankfully California is collecting this very important information, under race, the only choice for me was Asian. And I thought that was very interesting given how diverse we are. So we will discuss more on that later. Next slide.
So we have a question here, and it says, do you think that Asian American Pacific Islander communities face barriers to healthcare access? You guys can go ahead and answer that question however you feel is correct.
Just to mention that in order to take the poll, there is a website called menti.com. You can go to your phone and use it, or open up another browser and put in the code 326065. And that is how you can give your answer. If you can't access the Menti poll, please put your answer in the chat. Yay! Sorry, we forgot to mention about the Menti poll. 2 people, woohoo! Great. And maybe you're unsure, and that is totally fine as well. And if you have any technological issues as well, please add that to the chat. If you can't see something, or you can't see the slides, or you having difficulty accessing the Menti poll, there is technical assistance. Okay, well, we're going to end the poll, and there are some answers in the chat. Next slide. So we have another poll, and we were wondering how you see what those barriers are. You can rank them if you like, or add something into the chat. And we kind of came up with our own answers here. So if you don't agree, again, you can use the chat. This is a very cool feature, how in real time it sort of reorders all the things that we listed. Isn't that cool, Kira?
Yeah, it is. I've never seen this feature done before, so I think this would be very useful for NHF in the future.
Okay. Great. Can we go to the next slide? And so we agree that language is probably the biggest barrier for the AAPI community in the United States. If you can believe it, the AAPI community represents over 250 languages and dialects. So you can imagine how difficult it would be for someone monolingual in one of these languages to try to access some of the medical facilities, emergency rooms, interpreting lab reports and things like that. So we're going to play a quick game, and this is for you, the chat, just to kind of illuminate our point. I was wondering if you can tell me what language is the first bullet point that you see on your screen. What language do you think that is? No judgment if you get it wrong. Jiaye. Apparently is how it's pronounced. I could be butchering that. Any answers, Christy? Maybe people are afraid to answer. So that is Chinese. Okay. The next one, Dugo. I know that there are people out there who know this answer. Dugo. This is Tagalog. So it's language spoken in the Philippines. Okay, the next word. Does anyone know what this is? The third one. Christy, are we getting anything in the chat?
We are currently not getting anything in the chat. We had 2 people answer correctly to the first one that said Chinese.
Oh, okay. I'm going too fast. Okay. All right. Well, this is Korean. What about the fourth one? So you can't Google cheat this one. All right, well, this is Cambodian. And the last one, Coco. And Kira, do you want to share what that word is?
So cocoa is Hawaiian for blood.
Yes, and actually you answered the next question was, which word do you think that all these words represent? And the word is the word blood. And I thought we would just throw in this really funny, not funny, but helpful pronunciation, not that I am fluent in Vietnamese, but I did want to just point out that if you ever see N and G together in a Vietnamese word, the pronunciation is not nigga, but it's pronounced eng. So just like in sing. So that's one little helpful tip. And then if you love Vietnamese food like I do, and you want to order some of the delicious noodle soup, it is not pho, it is actually pho. So we just wanted to add that in there at the last minute. About 3/4 of AAPIs, or 77% to be precise, speak a language other than English at home. And more than 1/3 are limited English proficient. So most healthcare facilities do not provide adequate language support, including emergency rooms, and only 1 in 4 teaching hospitals provide training for doctors to work with interpreters. So you can imagine how incredible these language barriers can be, especially in something like bleeding disorders, when we are already, for English speakers, fighting in the emergency room for treatment before diagnosis, for explaining hemophilia and other rare bleeding disorders to maybe an intern or a resident or other doctors who are not learned hematologists, or even learning about the clotting cascade in your own language. In Southern California, we do have a very diverse and large group of AAPI immigrant population, and I just wanted to share that the number one need in that group is for insurance help. And it is very difficult when we go through this because we always have to find someone to be an interpreter. The next highest need is for school help. And then the third is immigration. So that's just a need that we do have that is unmet in the community. Next slide.
So the cultural makeup of AAPIs are diverse, and therefore it's very difficult to generalize how cultural differences may present barriers to access in bleeding disorders. So many AAPI cultures stigmatize disability and mental health and blame issues on things like curses or even like a lack of discipline. different cultures have different ways of addressing that. Some examples I can think of, I've had many friends who have told me about kneeling on rice and on uncooked rice, and I guess it's a way of disciplining your kid. And examples of a lot of people from Hawaii may have heard of this or experienced it themselves, but getting hit by bamboo or mango wood, because mango wood is a very hefty wood, and that's how you would get disciplined. So with a strong history of colonization in many of these areas with high rates of AAPIs, there can be a history of resistance or mistrust in quote-unquote the white man's medicine. So leading a lot of cultures to heavily rely on the use of complementary medicine like teas, or what I can think of when I used to have a fever, I wouldn't take things like Tylenol to reduce my fever. My mom would make me sleep on tea leaves because the tea leaves are supposed to naturally draw out the heat from your body. So this includes the possibility that preventative health care measures may not be common in their country of origin. So there is a model minority myth, which is the assumption that all Asians are well educated and wealthy, but many Asian immigrants have a low educational attainment level and poor medical knowledge, and this can be for a multitude of reasons, socioeconomic factors, and of course the language barriers. So for example, 30% of Vietnamese Americans older than 25 have completed less than a high school education compared to 11% in non-Hispanic whites. So consequently, greater effort must be taken on our part to educate patients and families about the long-term implications of chronic conditions and the potential for patients to change outcomes through close clinical follow-up.
And again, I just wanted to point out that these are kind of generalizations and based on our experience. And as we mentioned at the beginning, we really represent quite an array of different ethnic groups with different cultures, even among ourselves. I wanted to share for even me something Kira mentioned at the beginning about stigmatizing disability or mental health. When my son first got diagnosed with hemophilia, my mom forbade me to tell anyone, even my family. So we didn't even share his diagnosis with anyone for 4 years. And you can imagine how difficult and painful that was for us not to receive support, being judged why he was wearing a helmet, why he was covered with bruises and things like that. It was really, really difficult. And finally, I just had to break out from under her order. So the other thing that I think was very interesting, at least that I've observed here in Southern California, with some Asian countries, and some people immigrate to the U.S., in their countries of origin, for those that are more developed, they only use one type of clotting factor. So for example, in Korea, they only use Advate or Donovate. And so when they come to the United States and then they're smashed with 21 different options, it really is quite a shock, and there is education that needs to be presented for these communities, because we kind of take it for granted, and we take it for granted that we have all these different options. So that's an exciting and interesting observation. Okay, next slide. Wow, insurance access. We can talk all day about this, and in fact, I do believe there are NHF breakout sessions wholly devoted to this topic, and in fact, we do advocate for this year-round. NHF and all the chapters in the country go to Washington, D.C. We have state days all about insurance, because we know insurance is critical for people with bleeding disorders, because our medicines are the most expensive in the world. I thought it was really interesting. I did a little research, and it turns out that prior to the ACA, the uninsured rate for APIs was actually pretty good. It was about 15%, which was, I mean, that is not a good percentage, but pretty good from the point of view that it was about the national average. But when you start divvying that up, I was shocked to see that actually the uninsured rate in the Korean community was the highest, about 25%. 1 in 4 Korean Americans were not insured. And next was Pakistani and Bangladeshi communities. The lowest, interestingly, below the average was the Filipino communities, many who do already work in healthcare. And so, you know, a couple things come up to mind. One, we can't have all this data aggregated and just seen as one race and say, hey, AAPIs are fine with insurance because, hey, they're just the national average when you have all these different groups with varying degrees of needs. Thankfully, with the passage of the ACA, public and private coverage expansion cut the uninsured rate in half for the Asian American Pacific Islander community. And so we do have to keep fighting and ensuring that all peoples are covered with insurance. And I really think that this takes us to a really important next topic. Next slide that Kira is going to focus on.
Yeah, so AAPIs are the fastest growing immigrant population, with a lot of them being undocumented. So Kaiser Family Foundation reported that 20% of lawfully present immigrant children are uninsured. And that's just the percentage of those who are legally allowed here to be in the United States. So Medicaid and CHIP coverage, which is Children's Health Insurance Program, have a 5-year waiting period. For LPRs, which is legal permanent residents, that's the 5-year period that they have to wait until they can get some sort of coverage. But states have the option to waive the waiting period. So 29 states, including the District of Columbia and the Commonwealth of Northern Mariana Islands, have chosen to provide Medicaid coverage to lawfully residing children and or pregnant women without the 5-year waiting period. And you can read more about that if you want to at www.healthcare.gov if you want to look into that yourself. And so it'll provide you the list by each state, and if the state abides by that 5-year period that you can cut out, or by the CHIP coverage. So California is a yes to Medicaid and CHIP, and Hawaii is Medicaid only.
Yay, California. You know, one thing that's so interesting is this great disparity in health insurance coverage depending on state, and not to brag about California. I know we have fires, we have earthquakes, and we have flooding, but we do have great insurance coverage for people with bleeding disorders. And I will quietly say that if you do apply for our version of Medicaid here, it's called GHPP for adults and CCS for children. Immigrant status is never asked on the application. The only thing that is asked is residency, and it is also not checked. So I'm very thankful that California does provide important coverage to people with expensive and rare bleeding disorders. One thing that I really feel like we need to point out, because this is being discussed in many immigrant populations, not just within the AAPI group, is this new public charge rule. So you may have heard of this. This has just gone into effect February 2020. It's the Trump administration's new rule regarding public charge. So this is not a new rule, the public charge, and basically it is when you are a green card holder and then you are applying to become a U.S. citizen, you write on your application, the country wants to see whether you will become dependent on the social welfare system. Obviously, they don't want that. But one of the things they used to exclude is insurance. Obviously, it's a vital need. but they've now just added that in. So now when you do apply, if you are LPR or green card holder, within the public charge definition, the government will consider whether you're on Medicaid, whether you also are on food stamps, and whether you are a Section 8 or public housing user. So all of those three items can now be used as evidence that you may be inadmissible under the public charge rule. So that is something that immigrant nonprofit advocacy groups are finding are deterring people from applying to Medicaid because of this. And obviously a huge problem if you have a rare bleeding disorder and you have to choose between getting your child's factor versus applying for citizenship and naturalization. It's something that's, we haven't seen huge amounts of people, obviously, but it's very disappointing and it's very challenging. One thing that I did just find out is that COVID-19 care is exempted from the public charge rule. So if you have a bleeding disorder and you're worried about this, please still get tested. Treatment and preventative care testing is not included in the public charge test. I'm going to just see if Christy has any comments coming through the chat on this topic because it is super important. Christy, is there anything that's coming in as far as people's comments or concerns or questions on this topic?
No, Michelle, not on this topic specifically. There's a lot of discussion about your guys' points earlier about Reiki and tea leaves and things like that.
Oh, but, that's a whole nother breakout.
Exactly. But no, not the immigrant status at this moment, but I will continue to monitor it.
Let's do that. Let's do that next year, Christy. Let's do a session on all the different alternative treatments used within, because I got a whole lot. So we can do discipline. I was in the corner with my hands up, the slipper, and then we can do alternative treatments. So that would be a very long presentation. Next slide. Thank you. Okay, this actually, surprisingly for me and happily, came up as number 2 on our poll. The question of racism against Asian Pacific Islanders is not an issue. It is not something we are going to be arguing for because we are just taking this for granted. And I really want to encourage many of you who are watching that may not be as familiar with the history of Asian Americans and Pacific Islanders. If you are not familiar, because they don't really teach this in schools, I highly recommend that you watch this PBS special. It's only 5 hours, but it is so interesting. I just absolutely fascinating. I myself have learned a great deal from watching it. So we put the link up here. You can also Google it, PBS and Asian American history. But what I think I wanted to bring up today, because this is something that's timely and happening now, is the issue of Asian American Pacific Islanders as always being seen as foreigners. I know for me personally growing up, I can't tell you how many times I had people tell me to go back to where I came from. I'm like, well, that'd be kind of hard because I'm from here. So we're also seen as one group. I'm very frequently mixed up with other, at least in the bleeding disorders community. There are not that many of us. I can't wait for the day when someone mixes me up with Kira because she's so young and beautiful. But this really goes back to that issue of being seen as foreigners despite being Nisei or second or third generation. And really it's come to play more recently in the whole coronavirus situation. So there are over 2,000 incidents of anti-Asian violence that have arisen since the coronavirus has begun. And not to get political at all, but the president has frequently referred to the virus as the Chinese virus or Kung flu or the Wuhan virus. And so that really has, I believe, played a part in increasing the rise of the SALT battery and just animosity. I have friends who are afraid to send their elderly parents out or to even send their kids out to places like Costco and things like that. And I just really want to point out that many of us may assume, oh, that's happening in Nebraska, not to pick on Christy at all, but people assume that maybe this is happening in rural areas where there are not that many Asian Americans, but this is completely untrue. It's happened just a few weeks ago in Pasadena, where a group of Filipinas were spit on. It happened in my town next door with a family with 2 little kids, were called the F word over and over, and dogs, and to go back to China. It's happening a lot, and it really needs to stop. There is a website where people are collecting this data. It's a little bit of a complicated website, but if you just Google Stop API Hate, and if you know anyone who has faced this, we really want to encourage you to report it. It is available, the reporting, in so many different languages. I think a question that came through the chat was, how can we support the API community? And one of the things is not to be a bystander. I know it can be frightening at times, but not to be a bystander. If you see or hear something happening, if you can videotape, that would be great without fear of being assaulted. I also want to say that if this is something that happens to you, we highly encourage you to report it to the police and to report it as a hate crime for assault and battery. And I know this is a kind of funny because it may be a very narrow and unlikely situation, but it is very concerning if you are API and have a bleeding disorder. Obviously, if you are in fear of being assaulted or hit in the head or set on fire or hit with, like, these are actual examples of people who have suffered under the recent rise in anti-Asian violence under the pandemic, but that would be obviously more concerning for people with a bleeding disorder. Kira, is there something that you want to add? Anything?
I think you got it covered, but I do want to emphasize on the point of making a new session next year about different natural remedies. There's a lot in the Hawaiian culture that I could definitely contribute.
Yes. My mom has also forced me to drink some very unappetizing tea concoctions. Okay, next slide. So that, I know that we covered a lot in 35 minutes. It was very difficult for us to kind of distill everything down because there is so much we wanted to talk about and share. But we wanted to know if you had any thoughts about how we could respond to some of the issues that we brought up, especially in the relation to bleeding disorders. If you can just share those in the chat. You know, it is very interesting that some of the issues, many of the issues that you saw that we brought up overlap with other immigrant groups such as the Latino population. We added some of the things that we thought of, obviously, to address language issues. We believe that there should be better support for translation, interpretation in the medical field, in research, in clinical studies. I did see something about how most clinical studies involve white males. And of course, we're going to have more males in our clinical studies, but I do think it is very important to also study how maybe some of these things that we're looking into affect the AAPI population. For example, we have found out that inhibitors affect the Latino and Black communities at double the rate. Well, is that true also with us? We are not sure because I don't believe that this has actually been studied. The next point that we wanted to really share and hone in on is maybe not to have us all aggregated into one big group when we are studying some of the effects within the bleeding disorders community, because again, we are so vastly different, and we're not making a call to make sure all our research and all our needs assessment are broken down into the 100 plus ethnic groups, but at least to have some sort of separation on the major different groups that are out there. I think another thing is maybe through legislation, and there is actually a bill out there right now. I think, was I going to share on that, Kira? Well, okay. The bill establishes a series of programs and requirements relating to the health of minority populations, including provisions to improve data collection, health literacy, health workforce diversity, which is very important. I'm very blessed in California to have many API doctors and physical therapists and nurses that can perhaps understand some of my cultural concerns. And we would love to see more diversity in this area. I think Kira and I were also discussing about how we were the two only API NHF chapter staff. Yo, sister. And we're not saying, hey, go out and hire more, because we do understand the financial constraints, but maybe for chapters and foundations to really focus in on that, look for maybe prominent volunteers that can help step in the role, people who may be bilingual. If I ever find people who are bilingual, I'm like, hey, you're signed up as my #1 volunteer. So that might be something to help families feel comfortable. I know it's hard when a family might come to an event and they only speak a language that is not English. You might want to sort of ignore them, but it would be really nice to reach out and help make them comfortable. I also feel very strongly about insurance applications and Medicaid information being supplied in many, many multiple languages. Kira, do you want to add stuff also to that as far as suggestions? And Christy, if you have things to share that might be coming into the chat.
Yeah, so I think that if anyone who is watching this wants to pop up in the chat, like some ways that they think could help us better serve the API population within the bleeding disorders community, whether it's something you've done within your local chapter, maybe you have like community members who will help translate, or there's like a group where people will get together of the same language and help those who only speak that one language kind of process the information, like a peer mentoring type of group that you guys have taken on yourselves. Any suggestions like that that we could share within other chapters and the foundation as a whole to better serve our community would be a great help.
Yeah, thank you, Kira. Christy, are you seeing anything that's coming through the chat? And it's okay. I don't mean to put anyone on the spot.
We are good for now. Now we're talking evaluations. Sorry. There's a lot of chat that we're following very quickly through here. Lori posted a website link to the Asian Pacific Policy and Planning Council. So if you're interested in that, please click on that. That is on the chat site as well.
I think one thing that would be great is Len is talking about possibly having a chapter needs assessment that will go nationwide. And if that does pan out, maybe one thing is to ask, actually, what is the need? Because we don't want to force people to do things or make suggestions that are untenable. So what is the need is something that maybe we're just at question number 1. What is the need specific to the API community in the bleeding disorders? We are not a tiny group that people might think that we are, but we actually are quite large. Again, we are the fastest growing immigrant population in the United States. So more and more, I think, other foundations and HTCs and groups involved with the bleeding disorders will see more and more AAPIs entering in. And we feel very, Kira and I feel very strongly about health equity and making sure we include anyone who may feel on the fringe or may not feel included, and to make sure everyone has access.
Yeah, so the only way that we can really progress from here is to hear like personal stories on what you guys want to see change within the foundation, or how we address people within this community, because Michelle and I can only guess and assume based on our personal experiences. But again, that doesn't account for how many of us are actually out here in the population. So we don't want to speak on everyone's behalf. So if we get more personal stories, we can get, of course, it's all about like data collection. So we can find out ways on how to address the biggest needs within the community that we see occurring more and more often.
Excellent point, Kira. Well, if there's no more, that's pretty much all we have. I really encourage you to fill out the evaluations as long as you have good feedback. No, I'm just kidding. Fill out the evaluations, and please let us know. Maybe you need a little more time to process. To help us tackle this issue, we really want to make sure everyone is included and everyone has access. So thank you so much. Kira?
Yeah, thank you so much for coming and watching our presentation. We hope it helped in one way or another. But yes, feel free to reach out to us. Any questions or later conversations that you guys might want to have with us, we're more than happy to have them.
Yeah, and you can find Kira on the Hawaii chapter website, and you can find me at the Hemophilia Foundation of Southern California website, hemosocal.org, 감사합니다, which is thank you in Korean. My Korean stinks.
Mahalo for all of my Hawaii language people.
Thank you again.
Thank you, everyone.